Okay, today we are looking at the dangers of radiation. If you're interested in the uses of radiation, please watch that video to see a thrilling overview of those. So, too much exposure to radiation is dangerous.
Duh.
But why? Remember, radiation is ionizing, and when radiation is incident on cells, it has the ability to affect the DNA of those cells. This can cause the cells to mutate, and that can cause them to divide uncontrollably. That mass of mutated cells is what we call a tumour. So radiation can lead to illnesses such as cancer. If you have a high enough dose of radiation in one go, that has the ability to kill cells, leading to radiation poisoning or death. There are two different ways that you can be exposed to radiation. Number one, contamination, and number two, irradiation. Contamination is when the radiation is either on your skin or you've ingested the radiation, like eating a banana. Irradiation is when the radioactive source is at a distance from the person. And different types of radiation are more or less dangerous depending on if you're interested in contamination or irradiation. Alpha particles are the most dangerous for contamination. That's because alpha particles are the most ionizing, so they can do the most damage to your cells. Gamma is the least ionizing radiation, so that's the least dangerous for contamination. However, irradiation is a different story. Even though alpha particles are the most ionizing radiation, they are absorbed by a few centimeters of air. So, if the source is away from the person, most alpha particles won't be able to reach the person in the first place. Since gamma is the most penetrating of our sources of radiation, it is the most dangerous. That's because it can reach the body and it is still ionizing radiation. So, how can we prevent contamination and irradiation? We can use any of these things. Lead vests are sometimes used by workers who would be exposed to gamma radiation. Lead absorbs that gamma radiation. Hazmat suits can be used to stop workers being contaminated with radiation. They do that by covering the skin of the person. Same applies to gloves when handling radioactive sources. Sometimes you can't stop exposure altogether, but you can limit the amount of time someone spends exposed to radiation. In hospitals, doctors and nurses wear badges that have photographic film in them. Film darkens as radiation is incident on it. The darker the film, the more radiation a doctor or nurse has been exposed to. Once the film gets too dark, they should remove themselves from the source of that radiation. If you liked the video, please do like and subscribe. Please make sure you download the notes. They give a concise difference between contamination and irradiation, and the links between our safety devices and how they stop dangerous levels of exposure to radiation. Okay, thanks for watching.